the main thing with this um with these disorders that we're going to, it's not one specifically, there's multiple that we're going to talk about, but the main thing that um is linked to these disorders is like a person and how he views himself and how he views his body, and how that can uh, change the mental aspect of eating and consuming food. So, yeah. No, next slide. Okay, so as I said, eating disorders are serious conditions related to persistent eating behaviors that negatively impact your health, your emotions, and your ability to function in important areas of life. As people say, you are what you eat. So, um, having a healthy eating routine is vital. And in these cases that we're going to be talking about, um, they don't have the normal eating routine. Most eating disorders involve focusing too much on your weight, body shape, and food, leading to dangerous eating habits and eating behaviors. These behaviors can significantly impact your body's ability to get appropriate nutrition. Eating disorders can harm the heart, digestive system, bones, teeth, and mouth, and lead to other diseases. Yeah, perfect answer. So, over most of these eating disorders um, develop in teens and young adults, and I personally think the reason behind that is teens and young adults are really self-conscious about how they look, their body shape, and everything. So what happens is they become self-conscious and they change their eating routine to hopefully get into the shape that they want, or because they ate too much, they mentally get um they meant I say this they're mentally challenged because they ate too much and they think that they're gonna be fat, nobody's gonna like them, and so on and so forth. Um, with treatment, you can return to healthier eating habits and sometimes reverse serious complications caused by eating disorders. Um, next slide. Okay, so symptoms vary from each type of eating disorder, um, and I'm going to talk about all the different um, eating disorders. Yeah. Okay, next slide. Okay, so the first type that I want to talk about is anorexia nervosa. It's called anorexia most of the time, and what usually happens in this is it's usually the thing that happens is the person with anorexia is like doesn't eat, and he becomes too skinny, and it becomes really bad for him. And so it's characterized by abnormally low body weight, intense fear of gaining weight, and this distorted perception of weight and shape. So he just doesn't want to get fat, and by that he has a disorder, and he doesn't want to eat anything because he's afraid that he's going to get fat. People with anorexia use extreme efforts to control their weight and shape, which often significantly interfere with their health and life activities. Um, when you have anorexia, you excessively limit calories and or use other methods to lose weight. So basically, what this like to summarize this, um, the person with anorexia doesn't eat. He's afraid that he's gonna be fat. He wants to be in shape, but not having enough calories and enough nutrition for your body can harm you in a negative way. So reducing weight and having excessive weight loss is really bad, and sometimes it can get to the point of having doing self starvation, which is really deadly and really bad. Um, and it's all in the like mental. It's not this. There's nothing wrong with his body.
Yeah.
He just doesn't want to get fat. Do you have anything to add?
Most people with eating disorders don't eat on purpose. So what I meant to say is that what was it? Hold on, forgot. Just keep going. Forgot what I was gonna say.
I think what you're trying to say is they don't have any control over it. Is that right? No.
Is that they know they need to eat, but they don't. They know they need to eat more, but because of their self-consciousness, they don't.
Yeah, that makes sense. Yeah, like they know that they want to eat, but their mind, like it's like your heart's saying yes, but your mind is saying no. Does that make sense? I don't know if that's correct actually. Anyways, so yeah, they don't really have any control over it because it is a disorder. So, um, it's all mental. The brain is releasing unwanted neurotransmissions that cause him to think this way. Next slide. Bulimia nervosa. This is the other side. And what happens is the main thing is you have episodes of binging and purging. I'll talk about this. Binging is when somebody eats too much, and purging is when he doesn't. Okay, so what usually happens is in one episode he eats a lot of food in a short time, and then he feels bad about himself and he tries to get rid of the extra calories, but he does it in an unhealthy way. Because of guilt, shame, and intense fear of weight gain from overeating, you may force vomiting, or you may exercise too much, or use other methods such as laxatives to get rid of calories. So let's say for an example, um, this person is traveling and he goes to a hotel with an open buffet and he can eat everything he wants unlimited. And he ends up eating too much, too much than his normal self. The next day, he feels bad about himself, and his mind forces his stomach to vomit. He exercises too much over the limit of say 3 hours of exercise, and so on and so forth. So that's just an example of this bulimia, and this is this bulimia. Am I making sense or no? Oops.
Yeah, makes sense.
Yeah,
Uh,
yeah, yeah, yeah.
more binge eating and purging. Okay. Um. Next slide. Okay. This next one is just the binging part. When you have binge eating disorder, you regularly eat too much food and feel a lack of control over your eating. Um, you may eat quickly or eat more food than intended, even when you're not hungry, and you may continue eating even long after you're uncomfortably full. Um, and then after the binge, he might feel guilty and ashamed of this behavior, but he does not compensate in exercise at all. And and as we mentioned um, in the blood disorders when we were talking about it, obesity is one of the main causes for most of these disorders that we talked about, such as diabetes, such as hypertension, kidney failure, everything. So this is really, really, really dangerous in terms of the blood as well. So it's really important to look out for this. Um, and also, embarrassment can lead to eating alone or to hide your binge and may even cause even other mental side effects such as depression or anxiety. So this is a really bad disorder that people need to look out for.
And eating disorders also.
Yeah, this is eating disorders.
Oh yeah, it will definitely cause depression.
Yeah, exactly. And next up is rumination disorder. Um, this is repeated and persistent regurgitating food after eating, which is basically throwing up. But it's not due to any medical conditions. It's all in the brain. And or another eating disorder such as anorexia, bulimia, or binge eating disorder. Food is brought back into the mouth without nausea, and regurgitating may not be intentional. So the brain sends a signal to the stomach to no, to regurgitate. That's a hard word to say. Um, and most of the time, the food is usually it's either if it goes up, it's either re-chewed and re-swallowed or spit out. Um, the disorder may result in malnutrition as the food in your stomach, like the nutrition that you're eating, is going away. So you might end up in malnutrition. A person eats significantly less to prevent the behavior. The reoccurrence of rumination disorder may be more common in infancy or in people who have an intellectual disability. So again, it's all in the brain. There's nothing wrong with the body, like the stomach. You didn't eat anything bad that your body wants to get rid of. The brain just sends a signal to the uh, stomach to throw up. Is that understood?
So immediately after the person with that disorder eats, he spits out the food.
Excuse me, I didn't hear what you said. Can you
Like
repeat?
after the persons with that disorder eat, he immediately spit out the food.
He doesn't spit it out. He throws up. There's a difference.
Oh yeah, like he vomits. So
Yeah, he vomits. Yeah,
because then there is no reason of eating because what's inside has
he's gonna go out. Yeah,
yeah.
exactly.
So how
Yep,
does the
yep,
body get the nutrition and that stuff?
exactly, exactly. Next slide. Oh, this is okay. Avoidant slash restrictive food intake disorder. Um, this is when this is different from the other disorders because it doesn't have to do with like being in shape or being size in them, like having mental consciousness about um, your body. This is mainly because you're scared of eating because of any other thing, such as if you're afraid to choke, you don't want to eat. You're afraid to vomit. You don't like the way like the the food looks. You might think like you're scared of the food itself. Any other reason that makes you avoid food, because you don't have interest in eating. You avoid food because of certain sensory characteristics, color, texture, smell, taste. You just don't want this. Like it's usually with kids because they don't want to eat anything. They don't want to try anything new, so they become scared of it. Um, Fear of gaining weight. This disorder can result in a significant weight loss or uh, failure to gain weight in childhood, as well as nutritional deficiencies that can cause health problems. So basically, any reason, like I think we all know, like either if we had younger siblings or anything, or we see a young child refusing to eat, this is the disorder that we're talking about, and it's when it reaches a severe, um, a severe denial. In that case we can call it a disorder. Next slide. When should a person see a doctor? What determines um, a normal um, food diet or food restrictions from these disorders? An eating disorder can be difficult to manage or overcome by yourself. Eating disorders can virtually take over your life. If you're experiencing any of these problems, or if you think you may have an eating disorder, seek medical help. So I'm going to talk about it in the next slide. Next slide, Rayan.
So
Okay, so how
things
oh, the حق cough mind.
things to look out in in detecting eating disorders include skipping meals or making excuses for not eating, adopting an overly restrictive vegetarian diet, excessive focus on healthy eating, making own meals rather than eating what the family eats, withdrawing from normal social activities, and persistent worry or complaining about being fat and talk of losing weight. Uh, there are more things that you should look out for, include frequent checking in the mirror for perceived flaws, repeatedly eating large amounts of sweets or high-fat foods, use of dietary supplements, laxatives, or herbal products for weight loss, excessive exercise, calluses on the knuckles from inducing vomiting, problems with loss of tooth enamel that may be a sign of repeated vomiting, leaving during meals to use the toilet, eating much more food in a meal or snack than is considered normal, expressing depression, disgust, shame, or guilt about eating habits, and eating in secret. The exact cause of eating disorders is unknown. As with other mental illnesses, there may be many causes, such as genetics and biology. Certain people may have genes that increase their risk of developing eating disorders. Biological factors such as changes in brain chemicals may play a role in eating disorders. Psychological and emotional health. People with eating disorders may have psychological and emotional problems that contribute to the disorder. They may have low self-esteem, perfectionism, impulsive behavior, and troubled relationships. Family history. Eating disorders are significantly more likely to occur in people who have parents or siblings who've had an eating disorder and other mental health disorders. People with an eating disorder often have a history of anxiety disorders, depression, or obsessive-compulsive disorder. Dieting and starvation. Dieting is a risk factor for developing an eating disorder. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite and stress. Whether it's heading off to a college, moving, landing a new job, or a family or relationship issue, change can bring stress, which may increase the risk of an eating disorder. Complications include serious health problems, depression and anxiety, suicidal thoughts or behavior, problems with growth and development, social and relationship problems, substance use disorders, work and school issues, and eventually death. To diagnose whether you have eating disorders or not, they will do physical exam. Your doctor will likely examine you to rule out other medical causes of your eating issues. Psychological evaluation. A doctor or mental health professional will likely ask about your thoughts, feelings, and eating habits. They may also be asked to complete a psychological self-assessment questionnaire and other studies. Additional tests may be done to check for any complications related to your eating disorder. Treatment of an eating disorder generally includes a team approach. The team typically includes primary care providers, mental health professionals, and dietitians, all with experience in eating disorders. Here's the end of the presentation. Thanks for your attention.